It appeared as if we were finally turning the corner on the COVID-19 pandemic and heading toward a new normal. Thanks in large part to vaccines, severe COVID that causes death and hospitalization was contained. But two things happened. Not enough Americans have been vaccinated, so that led to a spike in the Delta variant as more people congregated indoors for the holidays. Then came Omicron, which is so infectious, it replaced Delta as the dominant variant in America in about 3 weeks. Hi, I am Frank Diamond, the managing editor of Infection Control Today. We want to give infection preventionists and others on the front lines the information that they need to keep going. They're exhausted. Joining me here to talk about this situation is Dr. Anthony Harris. Dr. Harris is the owner of HFit Health and the Chief Innovation Officer and Associate Medical Director for WorkCare. He's agreed to not talk about the organizations that he's affiliated with, but rather about the subject of the hour. How do we handle Omicron? Dr. Harris, thanks for joining us here at Infection Control Today.
Hey, Frank, thanks for having me again. My pleasure.
Okay, so let's focus on healthcare workers. What do they need to do in the face of an Omicron surge, do you think?
Sure. So healthcare workers hopefully won't see a huge change from the precautions that they've had to endure since the pandemic began. And that is obviously the barrier protections, the mask mandate. We know that is kind of in play and quasi in the courts in terms of vaccination as well. But certainly those are going to be the keys to making sure that healthcare workers are not putting themselves at increased risk more than they need to during this highly infectious period of the pandemic, meaning coming from Omicron. So continuing with the hand hygiene and the things that we know in healthcare we've had to do to protect ourselves will still be in play for much, much longer, it seems. At the end of the day, obviously we have our freedoms to make our choices. And, in the healthcare industry, I think one of our duties is to communicate risk, and we remain kind of agnostic as to how an individual so chooses to either partake or not of the interventions that are available to modulate their risk level. But going back to the numbers, we know it is far more risky from a standpoint of risk of hospitalization and death if you are unvaccinated than to be vaccinated. And certainly even the difference between fully vaccinated and boosted presents another level of risk if you are not getting that booster. So we'll keep communicating what we're seeing from the clinical data and being objective in that way, and certainly still cajoling everyone to do what the public health professionals like myself have been saying, which is do as much as you can to help get on the other side of this pandemic.
You and I have had conversations all throughout this pandemic, so I have to ask you, have there been has anything surprised you? And what's surprised you the most, and where does Omicron fall in that spectrum?
Sure. From a viral standpoint, viral propagation standpoint, unfortunately, I've not been too surprised. Early on, I give a monthly webinar. Used to be weekly last year, and I share to a cadre of leaders at large organizations, large companies, and I've shared with them that we're going to be in this for 5 years, and that most experts would agree until we have more of a global immunity or lack of susceptibility to these type of coronaviruses, that will be in this pattern. And so what we're seeing now is not a unique scenario as we look forward to the next, at a minimum, 3 years of COVID-19. And unfortunately, at this point, what perhaps did surprise me a little is not the virus itself, but the response from an antibody standpoint to the virus, right? I had hoped that our immune system would recognize more readily than it is, particularly with Omicron, the viral mutations that occurred. And unfortunately, at this point, it's looking like the virus is outstripping our own either natural or acquired immunity, and that's a little concerning.
Are you saying Omicron might be outstripping our own immunity?
So it is clear that with the over 30 mutations in the spike protein loci, the receptor binding site, it is escaping our immune system. And that is why we're seeing, one, out of South Africa data, increased reinfections. And we're seeing that now locally here in the US. And we're seeing, two, that people are susceptible and they are transmitting. And obviously, the viral load, which we know and we've learned is much higher than even Delta with Omicron. And that's contributing to the tremendous spread that we're seeing. And so I said, I wasn't too surprised by the viral mutations, the evolution of the virus, but what has surprised me more perhaps is the responsiveness of the general population and the fatigue that is set in, right? Now, I know that's a natural part of who we are in terms of enduring the pandemic, but I know that we are full of will and determination when we have our sights set on a particular goal as a nation. And I think coming together as a nation with the goal to minimize COVID-19 in the U.S. Is something that we have within our grasps if we are able to come together around some of the things that we know to be protective in regards to limiting transmission.
Are you that this virus exists in animals and apparently can mutate in animals and come back to human beings, and which is what it's a theory about Omicron.
Yes, yes. There's a couple theories out there of which is believed to be the origin of Omicron. One theory is, with animals. Another is one individual that had a prolonged infection of COVID-19, and that basically created a in situ petri dish of mutations to occur over that prolonged infectious time. That was the origin of Omicron with the tremendous number of mutations that we see. And certainly that's not going to be a rare case. And because we don't have substantially more than 50% of the global population immune or not susceptible through natural or acquired immunity, then we know we're going to have pockets of individuals that experience infections going forward, and mutations will happen, genetic drift and genetic shift. And if you look at the clades, last time I looked about a week ago, I think it was the order of 123 or 128 different clades or branch points that documented by GIS aid of the arrival of Omicron, right? And so we're going to see again more mutations happen that lead to variants such as Omicron, and we just need to be prepared for it. Indeed.
When I first started writing about Omicron, some of the experts in South Africa, where it was first spotted, were saying, "Well, this could be like a gift. This could get us out of the pandemic." I mean, if you have a variant that can shove Delta aside, which apparently it has no problem doing, and yet just gives you basically the sniffles, that could be what we've been looking for. Now, I don't know how much credence that theory has now, about a month later. Have you given that any thought?
Well, it's a theory that is not too far cry from some of the early theories that, or even political, if you would, approaches to coronavirus that we saw in the early pandemic days of 2020. We had nation leaderships, and not here in the US, but otherwise, come out and say, look, we're just going to sit back, have enough people become infected with coronavirus, and everybody will be immune eventually, right? And so certainly your readers and listeners will remember those days. And unfortunately, what we're seeing now is that, again, natural immunity only lasts so long. 90 days to be sure, 6 months, 180 days is the going wisdom as it stands right now. But that's for both natural and acquired immunity. And so Unfortunately, anecdotally, I'm having conversations and encounters with my colleagues in the healthcare industry who are now preparing for their their fourth shot, their second booster, because we know that very likely our immunity will wane even after a third dose. And likewise, we're going to see globally definitions of fully vaccinated changed. CDC leadership has already, Walensky has already suggested that over a month ago. We know Israel has already changed their definition well over a month and a half ago to 3 doses of an mRNA, in their case, Pfizer. And we know it's necessary to get our immune system, our antibody count high enough to help stave off our susceptibility to future infections.
You always hear about misinformation and how that's damaging our collective response to this pathogen. So tell me, what do you think are the 3 most damaging bits of misinformation that you have heard and that you've had to respond to?
Sure. One, that COVID is not real, right? That the virus actually doesn't exist, that it's all a governmental ploy to enumerate the number of people here in the US and abroad with some type of tracking system, right? I mean, outlandish as that sounds, for me personally, I have had serious conversations with people that believe that to be the case. And I think that not only cast a dark shadow over our healthcare community, but certainly one of a deep mistrust for the institution itself. Secondly, I think the biggest one that is damning for many people is believing that coronavirus, COVID-19 or SARS-CoV-2, is just a cold, right? That if you get it, you're just going to have the sniffles and you'll be fine. Now, majority of individuals do have mild disease after and during a infection of COVID-19. But the over 800,000 lives that we've lost as a result of COVID-19 paints a very different picture of COVID being a simple cold, right? And so that's what we want to message against in terms of the risk to everyone, but particularly to the vulnerable populations and those who have lost their lives already. And then moving forward, the other is the notion that we are on the other side or very near to the other side of this pandemic, right? That causes people to change their behavior, right? Be out and about, pretend that everything is back to normal. We know mandates have fallen away and precautions have fallen away, and that has led to the tremendous number of transmissions that we're seeing today. And so the mindset there is key in terms of not being susceptible to these false messages that can give us a sense of environmental safety that just doesn't exist. And so I think if I had to call out any 3, those would be it.
The head of the World Health Organization stated in no uncertain terms that it's the vaccines alone are not going to get us out of this. Booster shots alone are not going to get us out of this. We still have to do the social distancing, the masking, the hand hygiene. Will people go for that, you think? Will Americans go for that?
Sure. Well, I know some will, right? Certainly, we know that there are still many of us who, including myself and my family, who wear their masks when they go out and about. Certain states or certain counties, in particular certain cities, that is still mandated, right? I'm in Chicago, and we've had in play standing mask mandates for indoor. So we know that there will be a large component of the populace that still adhere to those practices that we know to be protective. And if we can do a better job and more robust job of messaging the right information, I'm hopeful that we will be able to get the even more overwhelming majority of Americans on board with that message. At one point, that was the case, where the majority of us during the lockdown, as we can recall, did adhere, and for the most part, to these type of regimens. And it's not for a matter of trying to keep people beholden to an overarching system, but only to communicate the risks that stands still and even ever more present with Omicron. That going to your holiday party, not taking any precautions, and going back home to grandma might not be the best opportunity to protect grandma, and that's what we want to message because on a daily basis as a physician, I'm hearing from my colleagues the loss of life that's still happening in the ICUs and hospitals day in and day out, and including people who are again fully vaccinated and boosted. And so we want to continue to message again so that we can pull more people into those practices. And I'm hopeful that we'll get back to the majority if we keep with that trend of messaging.
How concerned are you about long COVID, and is that just something that's long term? You can't worry about now. Got to worry about the emergency.
Well, sure. I think long COVID, and not even just long COVID, because long COVID, kind of denotes a long-term infection or being positive for COVID over a period of time, or being symptomatic from COVID over a period of time. Certainly, that we know there are a tremendous amount of cases. About 1 in 5 was a statistic that I'm familiar with would experience long COVID. And what we know today, just like you mentioned with HIV, right? That has a targeted kind of a mantra, if you would, as it infects an individual. We know that COVID does very similarly, particularly in the brain, things that are a little alarming to myself as a clinician. There's published data to show that it can cause a pan-inflammatory response in the brain, and strongest in the temporal lobes of the brain itself. And that's, and this is a very interesting point, right? That people may not understand. The reason why very likely you lose your sense of smell and taste is not from the virus infecting your nerves, the actual peripheral nerves here for sense of taste and smell, but affects the centers in your brain, all right? And so that is one of the theories and evidence that we see from MRIs that show this inflammatory pattern with people with even short-term infections of COVID-19. And so some theory says that every infection has some level of brain impact. We just don't know to what extent that's going to play out over time, and it may be even more devastating than we've learned today. Only time will tell. Now, I still hope for the best. But on top of that, there are still other things that keep me awake at night. Looking at the clinical data, one of the things that I think we may have mentioned on a previous program together here is antibody-dependent enhancement, ADE. And essentially what antibody-dependent enhancement is a weakness of our antibodies binding with a virus, much like we see with dengue and dengue fever, right? With the dengue virus, we have an infection initially, and we recover usually with mild symptoms. But if you get infected twice, you may suffer from dengue hemorrhagic fever and die, right? A more severe infection. And one of the theories behind the SARS-CoV-2 is that if we have a virus, not too much unlike Omicron, that binds very weakly to our antibodies because of mutations that have occurred, we can have either too few antibodies that are effective or not enough binding for effectiveness of our antibodies. And as a result, our antibodies help pull the virus, basically, I'm paraphrasing, pull the virus into our immune systems, into the cells that normally would help fight the virus and not allow it to replicate. But in this case of ADE, the virus now has a new environment to replicate and causes a far greater viral load and far greater disease impact on the individual. So there is no clear evidence I've yet seen of ADE occurring in the general population. But again, it's a little scary to me that we have such a mutated variant like Omicron that would potentially set us up for the likelihood of ADE more than any other variant out there that I've seen previously. So We'll keep fighting the fight, but again, there are nights where I go to bed thinking, will tomorrow be the day I read about a tremendous increase in severity and ADE could be the cause.
Finally, my readers are infection preventionists at hospitals. I'm going to ask, I would ask you what advice you have to give them, but I'm assuming that you would say just keep on doing what you've been doing. Should they shift it or tweak it in any way, what they've been doing, like just educating their fellow healthcare workers about the value of vaccinations and monitoring what's going on in the hospitals? Should I do anything different than I've been doing?
No, I just encourage them to keep at it. Keep up the good fight. Keep, protecting yourselves and protecting others in the hospital setting, but also be mindful of your loved ones when you go home in the evening. I think all of us, myself included, can get a little lax with my own self-awareness of, I am sniffling a little bit today, or my throat is a little itchy, more so than just having a dry throat. So just being mindful to listen to your own body in terms of, is this something that you're experiencing that could be a representation of a mild COVID infection and require you to then obviously take precautions both at home and at work, because I know we have a lot going on during the holidays. We have, our folks on call overnight and long nights to cover those who may not be at work during the holidays. But we want to continue to be mindful about our own symptomatology and how we can protect ourselves.
We've had, you and I have had a lot of conversations, and I have to say, I remember when I talk to experts like yourself, I kind of will say like, well, this person's basically optimistic about it. This person is kind of like dreading it, and I always had you pegged on the optimistic side, saying like, I remember when you first got the vaccine, and they just came out. Just got it last week. We're going to be fine. But it seems that you're almost now digging in. The mindset is who's going to help a lot of other people, and everybody else, even a layman like me, gets set for the long haul, right?
Yeah, and so I'd say I'm pragmatically and have been optimistic, right? Again, with my webinars I've given over the years about COVID, I've always said be ready for the worst, right? Prepared for the worst, but still expect the best, right? In terms of being able to get to the other side of this, knowing that it is going to be, and I've always told this, it's going to be a 5-year journey, right? I have no expectation this will be over in 2022 or the years after, but I do expect to continue to have more and more robust responses, more interventions, and hopefully more precautions in terms of how we as a general population approach our own health and wellness in general. Again, we're not seeing just increased cases of COVID-19. We're seeing more RSV. We're seeing obviously more flu this year than we did last year. And we're seeing more streptococcus, strep throat, right? And so we need to be vigilant, not just with COVID, but with other transmissible illnesses that we can prevent, and that could lead to, again, poor outcomes, not just for the general population, but primarily for those who are vulnerable, particularly if you compound them, right? Which we are seeing as well. So I'd say I land more so in the cautiously optimistic or pragmatic optimism, if you would.
Dr. Anthony Harris, thank you so much for visiting us again in Infection Control Today. As always, a very fascinating conversation.
Hey, thank you so much, Frank, for the opportunity. My pleasure.